for really putting together a great symposium today, and I hope you're enjoying it. I know we're learning something from it. What we're going to have at this point is a series of short TED-style talks on childhood obesity, different programs really looking from the cell to society. And I realized I forgot to introduce myself. I'm Daniel Hoffman, the director of the Center for Childhood Nutrition Education and Research on the first floor. We will have time for questions at the end of the session, about 10 or 15 minutes. And the complete bios of every speaker is in your handout, so I will just give a very brief introduction. And our first speaker comes to us from Baltimore, Anne Barnhill, who is a research scholar in global food ethics and policy at Johns Hopkins at the Berman Institute of Bioethics. So it's my pleasure, Anne.
Great. Oh, thank you. Thank you. So I'm a philosopher by training and a bioethicist, so it always feels like a real privilege to be in a room with for real scientists and practitioners. So I'm really happy to be here. Also, until recently, until July, I was a resident of New Jersey, so I'm also happy to be back in New Jersey. I still have some New Jersey pride, even though I live in Baltimore now. Okay. So my talk, do I have a clicker?
Press the button on the, there you go, one more. Oh, there you went.
Uh-oh.
No, you have to press the one on the left of the, there you go. One more. One more. Good.
Great, yay. Okay, so my talk is on research on children, diet, and health, some ethical considerations. So I know that the New Jersey Healthy Kids Initiative aspires to do a large longitudinal study on childhood obesity. So when I was putting these thoughts together about ethical considerations, what I was imagining, what I was thinking about the ethics of, was a longitudinal study that looked at children's diet and physical activity and presumably some other household characteristics and environmental variables and maybe genetics, and then looked at the connections between all of those variables and weight and health outcomes over time. So that was kind of what I had in mind. And when I thought about the ethical issues, oh man, there we go. And when I thought about the ethical issues with that kind of research, about 25 things came to mind, but because I only have 18 minutes, I tried to narrow it down to 4. Ethical treatment of research subjects, conflicts of interest and bias in research, promoting healthy and sustainable diets, and there I mean environmental sustainability or social environmental sustainability, and 4, recognizing the non-health value of eating and attending to multiple dimensions of well-being. Okay, so I only have 18 minutes total, so I'm going to zoom through most of these. Oh, that's my time clock. Okay, that's good. All right. There we go. Okay, number 1, ethical treatment of research subjects. Here, some of the main issues, and this really gets at research ethics issues, so people who are doing this kind of longitudinal study of childhood obesity. And some of the main issues here are kind of bread and butter protection of human subjects research issues. So securing assent of the children involved in the research, if that's appropriate, and permission of their parents. Making sure research subjects know that they can opt out of a long-term longitudinal study at any time if they want to. Ensuring only minimal risk to the children involved. And minimal risk there should be understood as including medical risk, for example, if you're doing blood draws from the children, but also social and psychological risks. So for example, in a study that's looking at diet and weight and what happens in the home, it's important to minimize the chance that children and their families feel stigmatized by the research, to give just one example. And another big issue here is privacy and protection of data. And what specifically is required ethically to protect research subjects is going to depend on the details of the research. And how these issues play out really depends on what exactly you're doing, and presumably an institutional review board would be on top of that. So I'm going to speed along. Topic number 2, conflicts of interest and bias in research. A conflict of interest, as understood by ethicists, is when your professional judgment about the matter of primary interest is influenced by money or another secondary interest. So, for example, what you prescribe to a patient is influenced not just by your well-founded professional judgment about what would be the best medication for that patient, but is also influenced by your relationship or contact with the pharmaceutical interest, for example. Or if you're doing nutritional research, the research question that you frame for your study is not chosen because it's the most well-formed research question according to your professional judgment, but because it's one that was suggested by the company funding the research. And what we worry about with conflicts of interest and bias in research is not just clinicians or researchers consciously acting on financial motive, but we worry about them being influenced by their relationships, financial relationships, and other contacts in ways that they don't even realize. And there are various mechanisms whereby funders of research can influence that research in ways that are considered problematic. They can try to prevent publication of unfavorable results from a study. They can try and spin results in a favorable way, so they can influence the interpretation of study results in a favorable way. And another way, which is very important, in which funders can try and influence research, is to influence the research question that is asked. So I went to a talk recently by Marion Nessel, who's a nutrition professor at NYU, who I think just last week maybe, published this book, Unsavory Truth, How Food Companies Skew the Science of What We Eat. And she's a very, very outspoken critic of nutrition research being funded by food companies. And she gave this one example that really stuck with me of how someone who funds research can influence that research by influencing the research question. And she said it's very different to ask, what is the health benefit of consuming X, rather than to ask, what is the health effect of consuming X, right? So you can imagine someone, a food company who has an interest in identifying the health benefits of consuming X is going to want to shade the research question in that direction, rather than in the more neutral, what is the health effect of consuming X? Okay, just one example. Conflicts of interest and bias in research is incredibly complicated, and there is a lot of disagreement, even among ethicists. So I'll just say it's really important, I think, to develop a sound institutional policy that has multiple ways of trying to protect the integrity of research, to communicate that to the public very transparently, and then also to communicate about the funding of particular research projects and researchers transparently as well. Okay, number 3, promoting healthy and sustainable diets. An important public health goal is promoting healthy dietary patterns, particularly among children. Another important goal is promoting sustainable diets, meaning environmentally sustainable diets, diets that have a lower greenhouse gas footprint, diets that use less water and land to produce. So looking forward, we, as a global population, need to produce more food for a growing world population, and we need to produce it in a way that reduces the environmental impact of food production. So shifting populations not only to healthier diets, but to healthier and more sustainable diets is highly desirable. And what this means in a high-income country like the United States is emphasizing increased consumption of fruits and vegetables, which would be good for our health because we don't consume enough fruits and vegetables, but emphasizing fruits and vegetables that have less environmental impact, emphasizing a shift from, emphasizing a reduction of meat consumption and a shift to some more plant-based protein. And the thought here, or my thought here, is as long as we're undertaking an ambitious effort to try and shift the diets of children in healthier directions, we should think about where it's feasible to also shift their diets in healthy and more sustainable directions. right? Because when we're trying to inculcate healthy dietary patterns in children, we should want those to be dietary patterns that they can sustain over their lives and that they can feel good about passing on to their own children. Okay. All right, number 4, recognizing the non-health value of eating and attending to multiple dimensions of well-being. A theme in my own work is that food is not just a source of nutrition and health. And I think this really came out in our panel earlier, that food and eating is really complicated, and we really need to listen to what people say about what it means in their lives. Eating and food have cultural meaning and social value. Eating and food work, where food work includes cooking food, but also shopping and meal planning and cleaning up after meals. Eating and food work are economically significant. So they can take a lot of time and money, and that means they have really significant practical impacts on people's lives. And so eating, including unhealthy eating, can have many kinds of social value and practical value for families. And I think if we really want to get a handle on the ethics of our efforts to promote healthy eating and health, and the ethics of research into those efforts, we need to really understand in detail these many kinds of social and practical value, so that we are not only promoting children's health, but promoting the well-being of families and not inadvertently undermining the well-being of families in some ways. So, eating is an intensely social experience, right? It has this foundational role in family life and social life more generally. Eating is like a social glue. Eating specific foods is central to our traditions. So Halloween pumpkins, but also Thanksgiving next week. So there are these specific foods, many of them not especially good for us, that have a central role in our traditions. So here's a Halloween pumpkin, but really it's like Halloween candy, maybe what typifies Halloween more. Eating is how we mark special occasions, birthday cake, birthday cupcakes. And foods are part of culturally significant practices. So these are my daughters, very proudly wearing their Central New Jersey, Girl Scouts of Central New Jersey vests, and holding Girl Scout cookies. So they sold Girl Scout cookies. It was really fun. It was very educational. They were really proud of themselves. It involved a lot of sugar and a lot of cookies in our house for many weeks. So what's my point? So there are a lot of ways in which foods that are not particularly health-promoting foods have value for us. So they're a part of culturally significant and valuable experiences. They're convenient, they're cheap. And given those many ways in which eating has value, efforts to eat more healthfully, interventions that try and get people to eat more healthfully, can have unintended consequences, social, psychological, and economic. And there's some anecdotal evidence of these consequences in the literature. So a study of a dietary intervention may report on something that a participant said about the pushback she got from her husband when she tried to serve more vegetables at dinner, for example. So there will be anecdotal evidence of these in the literature. And particular research projects may work closely with participants to try and identify and overcome barriers. And there are some qualitative studies that try and get at these unintended consequences. But the literature does not systematically report them. And there really is not very much information out there about the range and frequency of different kinds of negative consequences and how they might be experienced differently by different groups of people. And when we're thinking about children, families, and healthy diets, we really need to attend to these unintended consequences and try and measure them in research. Okay, I have 4 more minutes, so I'm going to try and give you some examples of what I'm talking about before I run out of time. So I'll give you some quotes from studies that get at these unintended consequences. Like last week, we had all this cake. This is the eating office. You can't lose weight in this office. Okay, so trying to make a dietary change means you might have to opt out of valuable experiences. Like if you work in the eating office where there's cake a lot, like you have to opt out of the cake, right? And there can be social consequences associated with that. And there's other anecdotal evidence in the literature about people feeling like they could no longer comfortably participate in community events or eat meals with extended family because their food choices like set them off as different, and that had social consequences. Here's a quote from a qualitative study of low-income Latino families with children who were obese. Overfeeding was seen as an expression of love or caring and was a source of bonding across many relational groups, including mother-child, father-child, grandparent-mother-child, and neighbor-neighbor. Attempts to curb practices like adding sweetener to milk, adding an extra meal to a child's diet, or sharing high-calorie treats with a visiting father were viewed by participants as a threat to important parent-child relationships. And the authors concluded that for these families studied, quote, relationships are preserved and maintained through eating together. Identifying with another in a close family way requires eating the food they bring and that they eat. So just another example of how changing dietary patterns can have social cost because of the way in which eating has social value. Okay, here's another one. We rarely observed a meal in which at least one family member didn't complain about the food they were served. So this quote haunts me. It's from a study of 150 mothers about their experience making home-cooked meals. The researchers note that parents are often given this advice that to promote their children's health, they should do more home cooking. They talked to a bunch of mothers and observed what happened in their homes and found that it was not very easy or pleasant. One problem was some women lacked basic resources, kitchens, or cutting boards or knives, or didn't have predictable enough schedules. But even those mothers who had well-stocked kitchens, who were reliably at home in the evening, some of them reported these like time trade-offs. Like I can either cook a meal or I can help my kid with homework. Or I can cook a meal or make sure that everyone gets to bed on time. Okay, all right, I'm almost out of time. So these are just some examples of what I'm calling the social, psychological, and economic unintended consequences of dietary change and healthier eating. So these matter because they're barriers to successfully changing behavior, but they're also costs of changing behavior as well. So we need to see them not just as barriers to be overcome, but as costs that need to be taken seriously. And some of these unintended consequences may be like public health or public policy outcomes of interest in and of themselves. So reducing financial strain on families, encouraging parental engagement with kids could be important outcomes in and of themselves. All right, so where does this leave us? My last 30 seconds. We need to understand the ways that healthy eating efforts exact cost and involve trade-offs, most especially for low-income families and families with working parents, where we should expect there to be the more cost and more trade-offs. Unintended consequences of healthy eating and weight loss efforts and behavior change efforts need to be acknowledged and systematically measured and reported. And more generally, healthy eating efforts and research on them should attend to multiple dimensions of family well-being. Diet, nutrition, physical health, of course, but also social, psychological, and economic well-being, and try and develop some meaningful, practicable measures of these and incorporate them into studies. So, as this exciting, ambitious research on childhood obesity develops, I hope it can incorporate some of these ideas. Thank you.